I'm joined by Charlton Murove. He's the head of research at the Board of Healthcare Funders. Very good afternoon to you, sir. So it's taken the president 3 months to find a pen, and now he's seemingly going to be signing the NHI Bill into law tomorrow. We know that the private sector has expressed massive apprehensions about this law. Just remind us what some of the key issues are, particularly as it pertains to you as healthcare funders.
Thank you, and good afternoon to you and the viewers. Yes, I think it's a little bit unfortunate that it's going to be signed in the form that it is in. I think the frustration of a lot of stakeholders is that ever since the NHI process began, there has been extensive engagement in that process. There has been research and input given to the process of bringing this bill into law. And the greatest regret has been that this has not been taken into account. So we now are sitting with a piece of legislation which really does not reflect that engagement process or the input that was provided. There are many issues that a lot of stakeholders are uncomfortable with. We are health funders, so obviously we are concerned about Section 33 of the bill, which limits the role of medical schemes, essentially relegating medical schemes to be providing complementary cover once the bill is fully implemented. When we provided comment on the bill, we did not only touch on this issue, but we also addressed other issues which we feel will compromise the NHI fund in terms of actually meeting the objective that is set out. So it's not a surprise that you have many stakeholders who are quite uncomfortable with the bill just because it is quite far from what the stakeholders have given in terms of input and comment.
Yeah, so where to from here as the Board of Healthcare Funders? Can we expect litigation as soon as the president has signed this bill into law?
Yeah, I think we are likely going to see a lot of parties going to the courts to seek relief just because of that frustration in terms of the lawmaking process. At our past BHF conference, we had the legal team representing the BHF discussing the legal options, and they gave extensive feedback in terms of the type of preparation that they have taken pending the signing of the bill. So yes, you can anticipate that a lot of stakeholders will be going to court.
Yeah, so the DG of the Health Department has said that even if there are legal challenges to the signing in of this bill into law, efforts would still be made to push through with the goals of NHI. But you guys are quite concerned about the funding thereof. What are your calculations around what would be needed for the government to properly fund the NHI system?
So a lot of input and figures that have been thrown around were that you would need in excess of 200 billion over and above what the government is currently spending. I think that number can be more than that. And given some of the pressures that you were discussing, like unemployment, it just makes it so difficult to implement the legislation as is. I don't think when stakeholders are going to go to court per se, they are going there to actually stop, but they're trying to adjust some of the features of the bill which are not accurate. And this should have taken place through the parliamentary hearings and the NCOP processes. So my estimation is that that is what the stakeholders are actually seeking to do, not really to stop the implementation. So yeah, we'll actually see when the bill is signed into law what the stakeholders will be challenging.
Yeah, so Charlton, just for clarity, does the Board of Healthcare Funders agree with the principle of universal access to healthcare, good quality healthcare of all South Africans? And if that is the case, what is the best way to do that in a society like ours?
Yeah, thanks for that question. I think we've always been a big proponent of UHC. Even within our own membership, the medical schemes, we're always encouraging them to adopt universal healthcare principles in terms of how they go about providing for healthcare. And I think the best way of actually achieving that is a multi-stakeholder approach to the issue of healthcare. It's not possible to try and solve the healthcare challenges facing the country on your own, whether you're government or whether you're private sector. So if you go back to the days of COVID, it was all stakeholders coming to the table and seeing how we can all contribute to the same to that COVID challenge. I think the NHI should have been developed in that spirit, where you bring all resources to the table and you find a way of actually achieving universal healthcare collaboratively. Unfortunately, this is not what we have seen.
Charlton Murove, thank you very much, sir, for your time.